The name hung in the air like a blade, Nathaniel James. And Sophia Chun watched the color drain from billionaire Marcus Whitmore's face as every lie he'd carefully constructed began to collapse. 48 hours earlier, the Azure Room commanded the 62nd floor of Chicago's Pemberton Tower, where reservations required a 14-month wait and entree started at $300. Floor-to-ceiling windows offered a view of Lake Michigan that glittered like scattered diamonds, while inside, black walnut floors gleamed beneath baccarat crystal chandeliers, each fixture worth more than a luxury automobile. The air carried the scent of Wagyu beef, century-old wine, and the particular hush that only obscene wealth could purchase. Sophia Chen moved through this cathedral of excess like a whisper, her 27-year-old frame wrapped in the restaurant's mandatory uniform: crisp white Oxford shirt, black silk vest, charcoal trousers with knife-edge creases, shoes polished to mirror brightness. Her black hair was scraped into a bun so tight it pulled at her temples, revealing premature lines around eyes that had witnessed too much loss too young. Exhaustion had carved itself into her posture, visible in the microscopic tremor as she balanced a tray of Chateau d'Yquem, each glass representing $400 of golden liquid. She had been standing for 12 hours. Her shift had begun at 9 that morning and wouldn't end until 11 that night. Tomorrow would be identical, and the day after. Because her father's Alzheimer's care facility cost $18,000 monthly, and the specialized memory unit he needed didn't accept insurance, and the disease that was slowly erasing him from existence didn't care about her exhaustion or her destroyed dreams. 4 years ago, Sophia had been completing her pediatric nursing degree at Northwestern University, top of her class, positioned for a prestigious fellowship at Children's Memorial Hospital. Then her father's diagnosis had arrived like a meteor strike, obliterating everything. The disease had progressed rapidly. Early onset Alzheimer's at 56, vicious and complete. Within 18 months, he no longer recognized her. The care costs had consumed their savings, their home, her education fund. Sophia had withdrawn 3 credits before graduation, sold everything she owned, and eventually found herself here, invisible among the wealthy, refilling water glasses for people who spent more on a single meal than she earned in a week. Tonight's crowd represented Chicago's apex predators, venture capitalists, real estate moguls, tech founders, and Marcus Whitmore, founder and CEO of Whitmore Financial Group, a private equity empire valued at $12.8 billion. Whitmore himself commanded a personal fortune of $3.4 billion, according to Forbes' most recent wealth index. He sat at table 12, the restaurant's premier position, wearing a bespoke Tom Ford suit in charcoal gray that had been hand-tailored in Milan, complemented by Berluti Oxfords that cost more than Sophia's monthly rent. At 49, Whitmore possessed the particular arrogance of generational wealth compounded by additional billions earned through ruthless acquisition. His face, tanned from a recent Côte d'Azur vacation, held an expression of permanent satisfaction, as though the universe existed to confirm his superiority. He was dining with board members, for men in similar suits, discussing a hostile takeover, and had brought his 6-year-old son. The child sat beside his father, small and quiet, with Whitmore's dark hair and his mother's delicate features. He wore a miniature suit that probably cost more than Sophia's entire wardrobe. His name, according to the reservation, was William Whitmore III, and he had barely touched his $100 children's menu meal, seared salmon that he pushed around his plate with listless movements. Sophia had noticed him immediately, the way she noticed all children despite her shattered nursing career. Something about him registered wrong, the way he held himself too still, the shallow quality of his breathing, the faint grayish cast beneath his thin skin. Professional instinct screamed warnings her position didn't permit her to voice. She was refilling water glasses at table 12 when Whitmore's voice cut through the restaurant's refined murmur. "William, sit up straight." Whitmore's don't slouch. His tone carried the casual authority of someone accustomed to absolute obedience. The boy straightened mechanically, and Sophia caught the slight wince, the way his small hand pressed briefly against his chest before falling back to his lap. Her nursing training cataloged symptoms automatically: labored breathing, fatigue, chest discomfort, pallor, possible cardiac issue, possibly serious. She should have walked away, should have returned to the kitchen, to her station, to invisibility. But she watched the child struggle for breath while his father discussed quarterly earnings and felt something crack inside her chest. The part of her that had chosen nursing because she couldn't stand watching people suffer in silence. She set down her water pitcher with hands that had steadied with purpose. Her voice, when she spoke, was quiet but crystalline. "Excuse me, Mr. Whitmore. I don't mean to interrupt, but I'm noticing some concerning symptoms in your son. Has he been evaluated recently for what?" Whitmore looked up from his conversation, his eyes focusing on her with the irritation of someone whose time was being wasted by furniture that had learned to speak. "What are you talking about? Your son appears to be experiencing respiratory distress and possible chest pain. I have pediatric medical training, and you think. Whitmore's voice went cold. "You're a waitress. My son is fine. He's tired. We've had a long day." He turned back to his board members dismissively. "As I was saying, the acquisition timeline, Daddy." The small voice was barely audible. "My chest hurts." The words stopped Whitmore mid-sentence. He glanced at his son with an expression somewhere between annoyance and concern, the look of a parent unaccustomed to dealing with childhood complaints personally. "William, we've discussed this. You're fine. You're just tired from the flight." But Sophia had seen the child's lips, the faint blue tinge at the edges, the subtle cyanosis that marked oxygen deprivation. Every instinct from 4 years of intensive nursing training screamed alarm. The boy's breathing had become more labored in just the past 2 minutes, his small chest rising and falling with visible effort. She knelt beside the child's chair, bringing herself to his eye level, her voice gentle. "William, can you tell me what your chest feels like? Does it hurt when you breathe?" The boy nodded, his eyes wide and frightened. "It's tight, like something squeezing." Whitmore's hand came down on Sophia's shoulder, not hard but firm, pulling her upright. "That's enough. Step away from my son. I don't know what you think you're doing, but you're a waitress, not a doctor, and you're creating a scene." Around them, nearby diners had paused their conversations. The restaurant manager, Daniel, was already moving toward the table with rapid, anxious steps. Sophia knew she had seconds before she was removed from the floor, possibly fired. Her father's care costs suddenly impossible to meet. But the boy's lips were bluer. "Sir, I'm not a doctor, but I completed 4 years of a pediatric nursing degree at Northwestern. Your son is showing signs of cardiac distress, possibly an arrhythmia or structural defect. He needs immediate medical attention. If I'm wrong, I'll resign tonight. But if I'm right and we wait, if you're right." Whitmore's voice rose, drawing more attention. His face had flushed red with anger and something else. Embarrassment at being challenged publicly, at having his parental competence questioned by someone he considered beneath notice. "My son has been seeing the best pediatricians in Chicago since birth. Dr. Harrison at Northwestern Children's. The Dr. Harrison, who charges $5,000 per consultation, has examined him repeatedly. Are you suggesting you know more than a doctor who's been practicing for 30 years? Daniel reached the table, his expression professionally neutral, but his eyes apologetic as they met Sophia's. "Miss Chun, perhaps we should call 911. Sophia's voice cut through the manager's attempted diplomacy. She kept her eyes on Whitmore. "Right now, because in approximately 90 seconds, your son is going to lose consciousness, and if he has the condition I think he has, every second we wait reduces his survival chances." The restaurant had gone completely silent. Whitmore stood abruptly, his chair scraping against the walnut floor with a harsh sound. "That's it. Daniel, remove this woman immediately and call security. I will not have some failed nursing student with delusions of competence." William slumped forward in his chair. The movement was sudden and wrong, the boneless collapse of a child losing consciousness. Sophia moved without thinking, catching him before he fell, her training overriding every other consideration. She lowered him gently to the floor, her fingers immediately finding his carotid pulse. Rapid, thready, irregular. "He's in SVT, supraventricular tachycardia." Her voice was calm, clinical, the voice she'd used in emergency simulations. "Someone call 911 now. Tell them 6-year-old male, history unknown, experiencing cardiac arrhythmia with loss of consciousness." Her hands moved with practiced precision, tilting his head back slightly to ensure airway patency, her fingers monitoring his pulse. Whitmore stood frozen, His expression transformed from anger to shock to something approaching terror. William! William! He dropped to his knees beside his son, his hand hovering uselessly. What's happening? What's wrong with him? Several things occurred simultaneously. Daniel spoke urgently into his phone, summoning paramedics. Other diners had risen from their tables, forming a concerned semicircle, and Sophia maintained her assessment, her voice steady as she spoke to Whitmore. Does he have a diagnosed heart condition? Any previous cardiac episodes? Any medications I should tell the paramedics about? Whitmore's face had gone gray. No, nothing. He's been tired lately, but Dr. Harrison said it was normal growth. His voice broke. Oh God. Is he dying? Is my son dying? Not if I can help it. Sophia's fingers pressed against William's neck, counting. His pulse is 180, but he's maintaining blood pressure. The SVT hasn't degraded to VFib. That's good. Stay calm. Talk to him. He can probably hear you even though he's unconscious. Whitmore leaned close to his son, his hands shaking as they touched the boy's face. William, Daddy's here. You're going to be fine. I'm so sorry. I'm so sorry. His voice cracked on the last words, tears visible in his eyes. The next 4 minutes passed in controlled chaos. Sophia maintained her assessment, her voice providing steady updates to Daniel, who relayed them to 911. William's pulse remained dangerously elevated but stable. Twice, his breathing became too shallow, and Sophia instructed Whitmore on how to help. Small actions that gave the terrified father something to do besides watch his son fade. When the paramedics arrived with controlled urgency, Sophia delivered a rapid, precise report. 6-year-old male, witnessed syncopal episode approximately 4 minutes ago. Suspected SVT with heart rate of 180. Blood pressure maintained. Breathing shallow but adequate. No known cardiac history. No current medications. The lead paramedic, a woman in her 40s, glanced at Sophia with professional respect. You medical? Nursing student. For years, withdrew before completion. You just saved this kid's life. The paramedic turned to her partner. Let's move. Get him on the gurney, for access, cardiac monitor. Sir, she addressed Whitmore, you're riding with us. Whitmore stood mechanically, his eyes never leaving his son as the paramedics worked. But as they prepared to lift William onto the stretcher, he turned to Sophia, his expression shattered. Come with us. Please. I need someone who knows what's happening. I'll pay whatever. Sir, I can't. I'm not certified. The paramedics, please. The word came out broken, all his arrogance stripped away, leaving only a terrified father. I don't understand any of this. You do. Please. Sophia rode in the ambulance, pressed against the back wall while paramedics worked. William remained unconscious, his small body dwarfed by equipment, monitors beeping urgent rhythms. Whitmore sat frozen, his expensive suit rumpled, his hands gripping his son's fingers with desperate intensity. Every few seconds, his eyes found Sophia's, seeking reassurance she wasn't qualified to give. At Northwestern Children's Emergency Department, chaos erupted in controlled medical precision. Doctors descended, a pediatric cardiologist Sophia vaguely recognized from her clinical rotations, ER attendings, nurses moving with synchronized efficiency. They whisked William into a treatment room while Whitmore provided frantic, incomplete medical history. No heart problems. No, nothing like this before. Yes, he'd been tired, but the pediatrician said. A nurse emerged 20 minutes later. Mr. Whitmore, your son is stable. We've converted his rhythm. Dr. Pradesh wants to speak with you about the echocardiogram findings. Dr. Pradesh was a slight woman in her 50s with kind eyes and a direct manner. She sat Whitmore down in a consultation room, Sophia standing awkwardly near the door, uncertain whether she should leave. Your son has Wolff-Parkinson-White syndrome, an abnormal electrical pathway in his heart. It's been there since birth, undetected. Tonight's episode was triggered by the altitude change from your flight, combined with dehydration and stress. If he hadn't received immediate attention, she paused meaningfully, the outcome could have been very different. Who made the initial assessment? Whitmore's eyes found Sophia. She did. The waitress. She knew. She told me something was wrong, and his voice cracked. I told her she was just a waitress. Dr. Pradesh's eyebrows rose. She looked at Sophia with renewed interest. You have medical training? 4 years of pediatric nursing at Northwestern. I withdrew before completion. Financial circumstances. I see. The doctor's expression softened with understanding. Well, your assessment was textbook perfect. You recognized symptoms most parents would miss and responded appropriately. You saved this child's life tonight. She turned back to Whitmore. Your son will need a procedure, cardiac ablation, to correct the pathway. It's routine, highly successful, but he'll need careful monitoring and lifestyle modifications. After Dr. Pradesh left, Whitmore sat in silence, his face in his hands. When he finally looked up at Sophia, tears streaked his cheeks. I called you just a waitress. I dismissed you. I almost let my son die because I couldn't imagine that someone serving food might know more than I did about anything. He stood slowly, his movements aged. Thank you. Those words are completely inadequate, but thank you. You're welcome, sir. I'm glad William is going to be okay. Sophia, may I call you Sophia? At her nod, he continued. I need to know why. Why did you walk away from nursing? You clearly have extraordinary skill. The question opened wounds she'd kept carefully sealed. My father has early-onset Alzheimer's. He requires specialized care that costs $18,000 monthly. I had to choose between finishing my degree and keeping him in the facility where he's safe. It wasn't really a choice. Whitmore absorbed this silently. Then, what's your father's name? The question seemed random, but Sophia answered. James Chun. He's at Riverside Memory Care. And his middle name? Nathaniel. Why? Whitmore pulled out his phone, typed rapidly. Because I need to know his full name for what I'm about to do. He showed her the screen, an email to his personal attorney, instructing full payment of James Chen's care facility costs indefinitely, plus a $200,000 payment for Sophia herself. That's not charity. That's me attempting to be slightly less of a monster than I was 3 hours ago. Sophia stared at the screen, her mind struggling to process. Sir, I can't accept. You can and you will, because I'm also doing something else. He made another call. Speaking rapidly, Dr. Harrison? Marcus Whitmore. I need to discuss my son's care. Specifically why you missed a potentially fatal cardiac condition during 3 years of examinations. His voice went cold. Actually, don't answer that. Your services are no longer required. I'll expect your full records transferred to Dr. Pradesh at Northwestern Children's by tomorrow. He ended the call and looked at Sophia. I'm also calling Northwestern's nursing program dean in the morning. Your tuition for completion of your degree will be fully funded, anonymously if you prefer, though I suspect they'll figure it out. You're going to finish. You're going to become the nurse you should have been 4 years ago. And when you graduate, if you want it, there's a position managing the pediatric health program I'm establishing at Whitmore Foundation. Starting salary $120,000, with benefits. Sophia's hands trembled. Why are you doing this? Because tonight my son called me daddy and said his chest hurt, and I told him he was fine. Because I valued my own authority more than his pain. Because you risked your job, maybe your father's care, to challenge me, and you were right. His voice broke. Because I almost lost him, and you're the reason I didn't. Let me do this. Please. A nurse appeared at the door. Mr. Whitmore? William's awake. He's asking for you. They walked to William's room together. The boy looked impossibly small in the hospital bed, but his color had returned, his breathing easy. His eyes found Sophia, and he smiled weakly. You helped me. I did. Sophia moved to his bedside. How are you feeling? Better. Dad called me Nathaniel. Sophia froze. What? Whitmore's face flushed. That's, when he was born, my wife wanted to name him Nathaniel James. I insisted on William, tradition, family name. We compromised, William Nathaniel James Whitmore. But she called him Nathaniel. After she died 2 years ago, I stopped using it. Tried to erase her from him. Make him into the son I thought he should be. His voice cracked. Tonight, when I thought I'd lost him, I called him what she called him. What he should be called. Because she would have listened when he said he hurt. She would have believed him. William reached for his father's hand. I like Nathaniel, Dad. Then Nathaniel it is. Whitmore kissed his son's forehead. I'm sorry. For everything. We're going to do better. 6 months later, Sophia Chun walked across the stage at Northwestern University, accepting her Bachelor of Science in Nursing with highest honors. In the audience sat her father, who wouldn't remember this moment by tomorrow, and Marcus Whitmore with his son Nathaniel, who wore a small medical alert bracelet and a huge smile. After the ceremony, She started her position at Whitmore Foundation, designing pediatric health programs for underserved communities. She never worked another shift at the Azure Room. But sometimes, passing the Pemberton Tower, she looked up at the 62nd floor and remembered the night she chose to be visible. The night being just a waitress meant everything.